jadi ini juga cerita yang lain, mamanya contohnya di Cina, mamanya ya, kita dapat hadiah sebuah mesin jahit. Kita pengen sekali menggunakan mesin jahit ini untuk membuat pakaian, tetapi kita tidak tahu bagaimana harus menggunakannya. Kemudian kita membaca instruksinya. Tapi saat itu lagi tahun baru Cina, lampu dimatiin, jadi yang ada hanya ada petasan ya. Nah, jadi setiap kali petasan ke atas kita bisa baca tuh, karena ada sinar. Nanti tiba-tiba kan habis, kita nggak bisa baca lagi, lagi. Jadi bagaimana baiknya, seberapa baik kita bisa membaca dalam kondisi sinar yang dikeluarkan oleh petasan tadi tidak banyak ya.
Imagine on the other hand that I give you a candle. If I give you a candle and you have a candle, nothing exciting, just a simple light, but very steady. Can you read a book by the candle? Yes, I can read a book. It's not exciting, but it's useful. I can read a book, I can learn how to use the machine, I can open a little store and start making progress and start making money. Heroin use, fireworks, Chinese New Year, big splash, darkness, happiness, sadness, candle, nothing special, but you can learn, you can do, you can help yourself. So, methadone, heroin, fireworks, methadone, candle.
Ya, jadi kita bilang tadi sama si pasien juga, coba kalau kita pasang lilin, kira-kira menantang nggak, menyenangkan nggak? Enggak, biasa banget itu. Tapi kamu bisa nggak baca secara stabil? Iya. Bisa nggak kamu akhirnya menyelesaikan instruksi apa yang ada di dalam buku petunjuk? Bisa. Nah, lilin ini tadi sama dengan metadon. Dia biasa banget, nggak menimbulkan naik turunnya. Kalau heroin itu seperti petasan tadi ya, seperti petasan sih. Memang api ya, sangat menggairahkan dan sebagainya. Tapi sebenarnya sebentar saja, kemudian nanti gelap lagi.
Okay, no more stories. You get the picture, right?
Kira-kira gitu analoginya.
Just want to give a little comment.
Yeah.
I think your story about the thermostat is very interesting, and it is also acceptable to explain to the patient. But the problem is here in Indonesia, we are not really familiar to, not all of us familiar to the thermostat. So perhaps we should develop our own story.
Right, exactly, very good point. Yes, thank you. Yes.
Kita nggak terlalu familiar ya dengan istilah thermostat ya, jadi mungkin kita memang harus menggunakan cara cerita yang kita bawa sendiri.
I gave you examples of the Zana story. We can, if we had more time, we could together brainstorm about stories and etc. This is going to be your task. Okay, this is a little bit of a challenge, but if you attentive, you pay attention, you talk to your patient. This is what you're going to do now. Okay, there's a patient coming, and that's exactly what we want to do. We want to invite the patient. We want to ask them, introduce, 1, 2, 3, very simple, no problem. And then these are methadone patients. We want to ask them following questions. Tell me how you understand your problem with drugs.
What the key purpose is, and then it asks, gives you some notes and a suggested interviewing technique. Oh, sure. I forgot. I have technology to help us here. So, if you have to ask the question, ask it as it appears on the ASI, and allow the patient to report more than one substance as his major problem. So you could say, like, Mr. Smith, which substance is your major problem? Ask the patient. That's really what we want to record. The patient knows what their primary methadone. This can be used as the major problem. In item 14, the problems associated with legal methadone may be recorded in item 22. So anyway, so you get some good suggestions from the manual itself here. So we should use the manual to help us, the goal is to identify the problem based upon years of use, and the level of use and the problems associated with that use. So it requires a little bit of skill on your part, but for most of the patients, it's going to be heroin. You know, if they're in methadone treatment, that's going to be their primary drug. It could be methadone if they don't want to be on methadone. You know, if they want to get off of methadone, if they want to detoxify, then it's okay to put methadone as their big problem, their primary problem. Okay? And if there's no secondary problem, you can code that as an N. If there's only one, put NN in the boxes there.
And what if we get the secondary, like 2 or 3 items, or should we put?
You have to. We're only asking for the most serious. You know, the most serious, then the second most serious. They might have other problems, but we're only interested in the top 2. Okay?
That's okay.
Bisa kita boleh tanya lagi. Jadi kalau dia nanya, saya juga pakai ini sering. Mana yang lebih sering frekuensinya? Mana yang lebih? Jadi kita tanya aja di dalam. Tidak pas tanya, kita bikin siapa dipancing lagi seperti apa. Dan semua kembali ke dia. Tanyanya perasaannya. Menurut dia sendiri bagaimana? Mana yang paling berat problemnya?
Ini isinya alkohol.
Ya, tidak harus ada. Tapi ditanyakan lagi, apakah alkohol akan menjadi masalah utama selama ini? Anda sudah berhenti 1 bulan. Apa menurut Anda? Gitu. Kalau nanya jadi kayak nanya, just asking about how to interview. How to interview, just asking and motivasi. Tapi itu ya. Jadi sambil proses itu sambil jalan dari proses seperti orang kita kalau konseling. Jadi wawancara bukan wawancara kayak cari duit. Jadi tadi kita tanya lagi, apakah alkohol itu menjadi alkohol? Oke, saya bulan Juni. Menurut Anda, apakah ini akan tetap menjadi satu yang masalah buat Anda? Apakah masih ada keinginan untuk menggunakan lagi? Gitu. Jadi kita tanya lagi, gitu. Sampai dia yakin nggak? Saya yakin nggak? Oke, MM. Tapi dia bilang, ya nanti kalau saya sudah sembuh dari sakit saya, gitu ya. Mungkin itu jadi selalu berbuat.
Okay. Was this person ever detoxified? Was there a time when they did not use drugs after they had started? Did they have a period of abstinence?
Yes, for about a year. He tried to abstain from the heroin.
Abstinence from the major drugs.
Yeah, from these major substances, from the primary drug, like heroin. In this case.
Kemudian kita akan tanya lagi kalau misalnya, kemarin saya waktu tahun 2000 dia masuk 2003, waktu tahun 2001 atau 2002 saya pernah berhenti dengan kemauan saya sendiri. Nah, berapa lama itu? Ingat nggak? Itu berapa lama? Waktu itu sempat berhenti sebulan, 2 bulan, berapa bulan kira-kira? Jadi menanyakannya kita berapa lama itu kita ikutin sebelum dia masuk metadon kan kalau berapa lama dia kan nggak masuk. Tapi sebelumnya dia pernah nggak? Ya abstinen secara sukarela pasang badan.
Sama lagi itu yang abstinence sekarang itu kan selama setahun kan. Tahun 2001 dia abstinen. Begitu dia jatuh lagi, pakai lagi. Nah tahun 2003 dia pakai metadon.
Ya oke, jadi itu 12 bulan.
12 bulan.
Ya, tetap
sampai dia metadonnya treatment yang sekarang dilakuin ini.
Ya, ini tadi sampai masuk metadon 1 bulan metadon atau
Iya,
seperti itu. Ya, jadi
Jadi
sama
sampai
setahun ditambah dia metadon 6 tahun kan? Ya, jadi itu bulan dikalikan. She already before the enter to the metadon she ever abstinent for 1 year and then 6 years in metadon.
Okay.
So we have to do 7 years. That's been abstinent in 7 years.
in 2001, he abstinent for about 1 year and
2001 to 2002. say 7 years, you know. Since
Tadi dia 7 tahun pakai.
with
2002.
2003,
Kan berarti dia 2002.
ada pakai
Metadon. Oh, 2002.
2001 dia
Kalau itu 8 tahun dia pakai. 7 tahun apa 8 tahun dia pakai. Heroinnya, tadi kan 7 tahun.
Marek mengobservasi bahwa Dr. Amul ini bagus sekali. Kenapa? Dia benar-benar mendengarkan apa yang diucapkan oleh Mela, sehingga menggunakan apa yang diucapkan Mela sebagai suatu analogi, yaitu waktu dia mengatakan dia sebagai supir bus, itu kemudian dianalogikan dengan kalau tadi
Yeah, then he takes something that patient tells him and he builds on that. And I'm like, bravo, very good. This is exactly what you should be doing.
dari situ kemudian Pak Amul mengembangkan lagi lebih jauh analoginya ya, jadi bagus banget deh gitu.
And then, yeah, because this is how you see he was able to pull her in. She was engaging and laughing and all of this. Yes, this is exactly very relaxed, very engaging, paying attention atmosphere. So that's how you talk to the patient. And it wasn't difficult, right? It was very easy to talk to her.
Nah, kita lihat tadi bahwa suasananya sangat rileks ya, sangat bisa membuat Mela juga terlibat ya, tidak ada rasa khawatir dan sebagainya. Jadi mudah kan sebenarnya membuat atmosfer yang seperti ini, mudah kan?
But you see, the problem here, there was a problem. She is very ambivalent. She does not see methadone or what she's doing as a perfect, as a good treatment. She's very ambivalent. Yeah, there's progress, but I don't really want to go on with that.
Yeah.
She doesn't. Yeah, go ahead.
Jadi tapi kita tetap ada punya masalah. Apa masalahnya itu? Kita lihat bahwa si Mela tadi itu ambivalen. Ya dia tahu, dia bilang bahwa metadon membuat dia lebih baik, tapi dia nggak mau lanjut dengan metadon itu ya. Jadi ambivalen.
And she doesn't understand. She has no idea how exactly methadone works in her body. I offered a kind of analogy of a food, and she bought it, but it's clearly not the same thing. And I wouldn't want to do it right now, but my next step would be to change that. Would actually to explain to her, to educate. She will become more engaged and more understanding if she knows exactly how drugs interact. She knows they go to the brain, but then that's pretty much it. She doesn't know anything else. And she doesn't know what the role of methadone is, some magical, unexplainable mechanism.
Jadi tadi ada perkataan-perkataan Mela yang menunjukkan bahwa sesungguhnya dia benar-benar nggak ngerti bagaimana metadon itu bekerja dalam tubuh. Dia cuma tahu waktu Marek mengatakan bahwa analoginya seperti makanan tadi ya, kalau kita makan kita rasanya seperti berenergi, dia langsung bilang ya seperti itu. Tetapi dia tidak bisa secara konsisten mempertahankan bahwa memang metadon itu bekerja sebagaimana makanan dalam tubuh kita. Jadi sini kita lihat bahwa dia memang betul-betul ambivalen.
And with people, this is perfect. Another perfect example. Because she doesn't know, she's susceptible to these misconceptions, to wrong information. Anybody can tell her that, oh, methadone is going to poison your liver. Methadone is going to rot your teeth. It's going to make your bone break or something like this. And she will believe, because what else? I mean, she doesn't know how it works. So she's susceptible to misinformation, to being affected by people who don't know, to distract her from the course of recovery. She's not strongly footed in the recovery because she doesn't know how it works. It works, but she doesn't know how.
Jadi yang namanya Mela ini sangat rentan, sangat rawan untuk dia terganggu proses pemulihannya. Kenapa? Karena pengetahuan dia tentang metadon itu minim sekali. Jadi dia bisa saja dipengaruhi dengan pandangan-pandangan yang keliru bahwa itu merusak lever dan sebagainya, bahwa itu merusak gigi, mengkeroposkan tulang dan sebagainya. Dan dia jamin, Marek jamin bahwa dia bisa dengan waktu singkat keluar dari metadon dan gagal sama sekali. Karena pengetahuannya yang minim.
Somebody comes and pushes her, she will fall off, really. Somebody tells her, oh, stop doing, this is bad. She will listen because she doesn't know any better.
Karena pengetahuan yang sangat minim, pengetahuan yang benar tentang metadon sangat minim. Kalau ada orang yang jorokin dia, jatuh beneran ini.
I think we repaid a little bit with George. We convinced her that, by authoritarian saying, hey, we scientists, we know better. You should continue. But it's not going to last a very long time until somebody takes an effort and explains it to her and gives her clear explanation what's wrong with her and how is she helping herself by taking methadone and making those changes. So she lacks education, and your role would be with her to actually put her very strongly, put her firmly on the path to recovery. Right now, this recovery is wobbly, and if anything comes, it can be easily stopped or pushed out.
Ya, jadi Kamela itu menjalani recovery atau pemulihan yang goyang ya, yang gemeter lah istilahnya ya. Jadi tadi diberitahukan oleh George maupun Marek mengenai masalah efeknya di dalam tubuh, tapi kan gaya mereka gaya seorang ilmuwan yang belum tentu akan meyakinkan dia. Jadi dia ini orang yang sangat kurang pengetahuan tentang bagaimana metode bekerja dan sangat rawan dalam menjalani pemulihan.
So we have one more guy. We need another volunteer. Let's do a little bit more talk. Hold on one second. Do you find it useful? Do you want to see another person, or you have enough?
Menurut Bapak Ibu berguna nggak simulasi?
Go home.
Teman-teman bisa
Hey, go home.
practice.
Practice. Okay. If you ask so badly, I'll do another practice. I need another volunteer.
Ayo volunteer, sukarelawan, ayo.
I need one more person.
Ayo cepat. Dokter Bella, silakan. Ya, nggak apa-apa ya, Dokter Bella ya. Ya.
I know.
Refleks ya.
Yeah, there was a lot of judgment here. There was a lot
Banyak
of
judgment ya tadi ya.
And this was exactly, I wanted, you see, I wanted to do this. I'm sorry for interrupting you. I'm sorry because you were trying to be gentle. And you were kind of stopping yourself. And we running out of time. And as a teacher, I have a responsibility for you actually to keep you on schedule. And I'm sorry, I should not have done it, but I was kind of,
Ya minta maaf ya tadi Bu Bella diinterupsi, tapi bukan apa-apa karena tadi Bu Bella kelihatannya sangat halus untuk mendekati dia, sementara kita sudah waktunya mepet, jadi nanti supaya bisa dapat tadi kan kita dapat nih.
I wanted to also push a little bit the envelope because I wanted to see your faces when he starts talking about killing people. Yes, I do, and I did.
Ya jadi emang dengan sengaja tadi, ya Marek tuh pengen tahu bagaimana reaksi kita waktu mendengar ada seseorang membunuh orang lain karena seseorang menggunakan racun. Dan dia lihat tadi perubahan wajah kita.
And I saw that you were shocked. Some of you were shocked, right?
Ya Bapak Ibu kelihatan shock tadi ya.
And you showed it.
Ya dan itu benar-benar dilihatin, dikelihatanin gitu loh.
Right. Anyway, nonetheless, was it difficult? This was a demonstration, an illustration. You told me when I asked you how hard it's going to be to get where I wanted to get, you said it would be very difficult. What happened? It wasn't difficult.
Ya, tadi Bapak Ibu bilang bahwa ini adalah sesuatu pertanyaan yang sebenarnya susah ya, bakal susah untuk memperoleh jawaban informasi ya. Awalnya ya, tapi lihat tadi, bagaimana dia bercerita begitu terus terangnya ya.
Again, if we had more time and it was different setting, if I would be alone with him in the room, or you will be alone, and anyway, if it would be in any way educational and any way appropriate, we could have got a lot of details.
Ya, jadi Marek sangat yakin dan menjamin bahwa kalau hanya berdua saja, Bapak Ibu punya waktu lebih banyak dan hanya berdua saja, Bapak Ibu dijamin akan mendapat informasi yang jauh lebih bagus lagi, yang lebih lengkap lagi.
Right? So, you see, a very simple way of elevating him to the status of the expert and us as a recipient of the benefit of his knowledge, it changes dramatically, saying that he is not talking about himself, but about his friends.
Ya, jadi
Change everything, but go ahead.
ya, jadi kita buat tadi sesederhana mungkin ya, dengan cara mengangkat dia menjadi seorang ahli dan meminta dia bercerita tentang apa yang dilakukan oleh umumnya orang pecandu, temannya, bukan dia.
When he started talking, when we were talking, we initiated talking about them, right? And he was talking they, and then started saying we.
Ya. Mula-mula dia waktu jawab dia pertama kali dia bilang bahwa mereka, terus lama-lama dia sudah mulai mengatakan kami. Ya, tanpa disadari dia berubah menjadi kami. Dan akhirnya dia bilang saya.
You see, this is the trick. It's not a trick. It's a useful tool. It's another tool of your toolbox. That if you approach a person, you start, tell me about your sex life. They're gonna say, no, I'm not gonna talk about this, Tell me, how many people you have sex in this party yesterday, and you're gonna get nowhere.
Ya, jadi Bapak Ibu ini salah satu perangkat yang lain ya. Kemarin kan sudah dengan perangkat komunikasi. Ini ada lagi perangkat juga komunikasi, tapi yang lain yang bisa Bapak Ibu dapatkan. Karena kalau kita langsung bertanya, katakanlah masalah seks, kita tanya, kamu bagaimana hubungan seksnya? Atau berapa banyak orang dengan berapa banyak orang kamu hubungan seksnya? Akan ada jawaban yang benar.
Yeah, especially initially, you're not gonna get anywhere. But if you ask him, elevate him to the status of the expert, and you engage him in helping you understand an important problem, he will play with you. We had a very good therapeutic alliance. We had a very good alliance because we were together. I wasn't against him. He wasn't against him. He was kind of leading me. I put him, I don't. You tell me, you take me on a tour. And he did. And he was very happy to do this.
Ya, jadi ini suatu strategi ya, dengan mengangkat dia menjadi seorang expert tadi, kita sudah membuat suatu persekutuan yang terapeutik. Jadi kita tidak saling melawan ya, tidak melawan, tapi kita bersama-sama membangun cerita itu sendiri.
But as he was telling, he clearly some of these experiences were his own experiences, right?
Ya, menurut Bapak Ibu itu merupakan suatu pengalaman dia langsung apa bukan?
Do we need to confront him on that?
Perlu nggak kita konfrontasi?
No, we don't.
Right. Yeah.
We don't need to. Exactly, we don't. We still can go with the education, with prevention efforts in terms of what they can do. How do you teach other people to use condoms every time? He was, and again, if we had more time, we would have gone there, but I didn't have time. But he said, this is unplanned sex, and therefore they don't use. Anyway, this was a perfect entry for me to actually do something.
Ya, kalau masih punya waktu yang lebih banyak, sesungguhnya tadi banyak yang bisa dilakukan lagi ya. Tapi kita lihat di sini, bahwa kita menggunakan kata ganti mereka. Apa yang bisa kita lakukan untuk menolong mereka? Kenapa itu bisa terjadi dan sebagainya? Dan dia menjawab tadi itu merupakan seks yang tidak direncanakan dan sebagainya. Bagaimana menggunakan kondom dan sebagainya. Jadi sebenarnya
What do you think about this exercise?
Bagaimana menurut Bapak Ibu?
What do you think about it?
Praktek tadi ini membuat masalah perilaku yang aman tadi seperti ini, menurut Bapak Ibu gimana?
Useful, right?
Berguna kan?
Okay. This was illustration of 3 points. 3 things.
Ada ini
At least 3 things.
Paling tidak 3 hal ya kita bisa dapat.
He's currently not injecting, he's not using, he's not planning on injecting, right? But I still did the prevention with him. So this is the illustration of one thing. You don't have to, you want to do risk reduction and education about the risk with everybody. Whether they are currently injecting or not, whether they are currently practicing safe sex or any sex or not. They do need this education.
Ya,
and they are not resisting. He wasn't resisting at all. He wasn't, I don't want to do this because I'm not injecting, I don't need it. No, he did not say. He actually played along very well. There were no problems.
Ya, jadi
An important point of this illustration is that I could just talk about this. We could have a discussion, right? Rather than me bringing a needle, and I could talk and tell him, look, if you destroy the needle, or do something like this, then you will be safe. And he will be saying, yeah, sure. So, do you think you should be doing, in the future, remember to do this? I could have done it this way, right?
Ya, yang kedua, sebenarnya tadi, kalau bisa saja Marek tidak mengambil jarum suntik ya, dia hanya bilang aja ngomong. Nanti kalau kamu ada keinginan memakai lagi atau gimana, kita lakukan begini, dan dia mengatakan iya.
Do you think it would have had the same impact as doing it?
Kira-kira ada nggak dampaknya? Apakah dia akan melakukan seperti mana yang tadi yang pertama dilakukan?
The chances that he will remember this event for a very long time are very high. He will remember this event for a very, very long time.
Ya, jadi kejadian yang tadi yang pertama di mana dia mempraktekkan langsung itu akan memberikan dampak yang lebih panjang. Dia akan ingat lebih lama, apalagi di tengah-tengah kita gini
Because
ya.
he did something in front of the audience. That's a different story,
Yeah.
but go ahead.
Ya, I already did.
But doing what I did is far superior than talking about it and then making recommendation. You should destroy. They will say, yeah, but trust me, it will never happen, or very rarely that it will happen.
Ini terapi bertindak ya, sekali lagi di Asia adalah terapi bertindak karena melakukan sesuatu, menindaklanjuti sesuatu itu jauh lebih terekam dibandingkan hanya dengan bicara.
So this was an illustration that, and this is one very simple illustration that how PDRC is not just talk therapy, it was doing therapy. We did something. I actually pulled him, so go ahead, translate.
I said, yeah,
Oh, you're ahead of me. She already knows what I'm thinking. So, what's the next thing I'm going to say? I forgot what I'm going to say.
Jadi sekali lagi bahwa PDRC bukan terapi bicara semata-mata, tapi terapi bertindak. Karena dengan bertindak itu jauh lebih bekasnya lebih lama. Ya, ada.
So yeah, doing right there is much more effective. Role playing, bringing syringes, cleaning, and you teaching skills that you can do rather than talk about. Do it in the session. BDRC is not just talk therapy. Okay, role playing, bringing toys, anything, practicing with condoms. I'm sure you have kids for sex education. You have things for HIV education. It's much more effective. Engaging them in letting. So after you could also send him a message. Next time you see somebody, teach them this. Make them a teacher. They will. The moment they teach somebody this, they will remember it forever.
Ya, jadi yang ketiga tadi, hal yang ketiga adalah dari mempraktekkan tadi, dia akan, dan kita akan memberikan pesan ya bahwa lakukan ini untuk orang lain ya. Jadi orang lain kita ajarkan, nah dia akan ingat itu karena dia lakukan itu sendiri. Dan nanti Bapak Ibu dalam BDRC harus ada banyak mempraktekkan ya. Jadi role play-nya tuh kalau perlu ada kondom, ya ajarkan itu ya. Ya bagaimana bleaching, ajarkan itu. Jadi jangan hanya diomongin.
And the last thing I want to mention about this little interaction is that I didn't just pull out this and say, let's do something or do this, right? I kind of, in step by step, I let him. I said, I called it, so you are protecting yourself, right? He said, yes. And would you like to learn a little bit more about protection? Yes. Would you like to do? Can we practice something? Yes. So you see, I didn't came upon him with one big yes. I led him on a string of small yeses, and there was no resistance, no problem in getting him to do what I wanted him to do.
Nah, tadi Marek sudah mempraktekkan dengan memperlihatkan pada kita dengan sangat baik bagaimana kita membuat suatu persetujuan dari klien yang dari langkah-langkah yang kecil. Tadi dia tanya, kamu sudah melindungi diri kamu dong ya? Iya, dia bilang, mau nggak kamu pelajari hal yang lebih jauh lagi, dalam lagi untuk melindungi diri kamu? Iya. Jadi dia nggak langsung dari awal langsung mempraktekkan tadi jarum suntik tadi enggak, tapi membuat persetujuan langkah demi langkah dari yang kecil demi kecil ya.
And after you get him to do something like this, something small, he's ready to do something bigger. He's ready for bigger contract. He's much more likely going to engage again in this game. Okay, so remember, last time we played, we did something in the session. How about we do something outside of the session, something that we plan ahead, and you go and execute, you try to do it, and then you come back and tell me how it went.
Jadi dengan adanya persetujuan tadi, itu sebenarnya klien sudah siap untuk suatu persetujuan yang lebih besar lagi. Contohnya, makanya pada pertemuan berikutnya dia sudah akan lebih siap untuk suatu kontrak yang bisa dilakukan di luar. Kemudian dia akan kembali lagi kepada kita untuk menceritakan apa yang dia lakukan di luar tadi sesuai dengan kontrak apa persetujuan yang kita buat.
Anyway, I'm gonna stop and I'm gonna give you a chance to ask questions.
Silakan,
So let's have a little bit of discussion. Now I wanna hear what do you think.
Apa yang Bapak Ibu pikirkan sekarang nih dengan kita membuat praktek banyak using ringing needle.
Trigger. Yes, perfect example. Maybe yes. You see again, this was not a complete exercise. In a complete exercise, if I had time, I would have asked him this question. When I brought up the needle and syringe, I would have asked him, how do you feel? Do you have anything going on in your mind right now?
Ya, jadi ini tadi bukan suatu praktek simulasi yang lengkap ya. Kalau yang lengkap biasanya Marek akan membawa jarum suntik tadi dan akan menanyakan kepada si klien, apa yang kamu rasakan sekarang dengan melihat jarum ini?
And if he said yes, it makes me start thinking about drugs. We would have used this opportunity to learn a skill how to stop this thinking about drugs right there.
Jadi kalau ditanya begitu dia klien bilang, ya saya mulai berpikir pakai lagi nih dok gitu ya bu ya. Nah di situ Marek mengatakan itulah kesempatan bagi kita untuk membantu dia menyetop pikirannya.
We would have used a different sequence of exercise. We would have first tried to deal with the urges or trigger part, and when we have solved the trigger part, we will continue with this protection part.
Ya, jadi kita bekerja dulu dengan persoalan bagaimana tadi faktor pencetus tadi, bagaimana caranya mengatasinya, keinginan untuk pakai dan sebagainya, tidak pindah dulu ke sana.
This is, you see this as a danger. I see this as an opportunity. For me, it's a test or opportunity to learn something about the patient. If I bring the needle and syringe and show it to them, and it triggers drug urges, I know that this is the area I need to work with him to overcome. I cannot avoiding the situation is not a good strategy because sooner or later he's gonna go out and going to see needle and syringe somewhere.
Ya ini ada bedanya antara kita dengan Marek. Marek melihat itu sebagai suatu kesempatan, kita melihat itu sebagai suatu hal yang membahayakan. Ya, kalau membawa ini tadi ya. Padahal ini menurut Marek justru disitulah kita menjadi target area kita untuk bekerja. Jangan menghindar. Kalau kita hindari, kita sembunyikan dan sebagainya, sooner or later, cepat atau lambat, dia akan pakai juga dengan cara yang bagaimanapun juga. Justru kita harus mengangkat ini ke permukaan di tempat klinik kita.
So you have a very good eye, very good concern, very valid concern, and you're thinking absolutely appropriately. But the answer to your question is yes. I will use needle, syringes, paraphernalia in the during the counseling session, even if they are triggers or involve urges, because it creates opportunity for me to help them overcome it, rather than avoiding and then sending them unprotected to the environment where they're going to be exposed to them anyway.
Ibu Eti pertanyaannya bagus sekali dan itu sangat kritis. Marek bilang bahwa itulah kesempatan bagi kita untuk bekerja membantu dia mengatasi hal-hal yang serupa. Justru itu harus dihadirkan dalam ruang klinik kita supaya dia berlatih daripada kita biarkan saja, kita menghindar, kita sembunyikan, tapi kemudian dia di luar menggunakan dengan cara yang lebih berisiko.
Yeah, this is a good question. It actually shows that you're thinking and planning. Yes, and you're absolutely right. In a real session, we would have make it not a mindless decision, a quick decision like it was, but more, balanced decision.
Yeah.
Here it was remember, not a therapy. These are illustrations.
Ya, ini ilustrasi saja ya Bapak Ibu, jadi potong ya. Jadi pengamatan Ibu Eti sudah sangat baik sekali. Jangan khawatir, itu suatu hal yang memang harusnya menjadi kesempatan buat kita.
I also talked to him before he came, and I knew that he's in a kind of stable recovery. But yes, very good point.
Satu hal yang membuat Marek yakin tadi adalah bahwa dia tadi sudah bicara sama Aris di luar dan dia yakin bahwa Aris sudah lumayan stabil. Jadi kegiatan tadi.
Other observations.
Ada lagi pengamatan lain ya?
Boleh sedikit keluar melenceng dari yang tadi.
Can I talk something out of topic?
Sure. Why not?
Thank you. Saya punya teman-teman saya dulu masuk rehab juga masuk rehab. Terus saya punya
Kira sendiri.
guru brother saya, teman-teman grup saya, dia cerita sama saya, tapi saya hilang kontak semenjak 2007. Jadi dia 2 kali cerita ke saya.
I was in the rehabilitation program we send them the nurses from this hospital to the rehab center based on the
Ya, dia tinggal tetap di Cibubur sini. Terus
and I go
yang dia alami ini, dia 2 kali relapse, 2 kali ketemu, 2 kali relapse karena teman akrab, apalagi sekarang. Saya apalagi, dan 2 alasan itu sama. Dia setelah jalan program rehab relapse gara-gara seks nggak tahan lama.
gimana maksudnya?
Jadi selama dia pakai, dia kan bisa tahan lama. Bisa tahan lama. Kalau ini kita kurang informasi tentang ini.
Is that user relapse after having got relapse because his use that he cannot stand long for sexual behavior. Unlike if they use drugs. If they use that, they can enjoy sex longer.
Sure, yeah, I heard the story many times like that.
Ini 2 kali kemudian kalau bercanda on klinik. Jadi ya ini yang jelas nggak terima. Cuman ini apa ya? Karena kami teman, tapi sejak 2007 hilang kontak. Saya care lah sama dia teman. Terus apa namanya, intinya mati gaya 2 kali itu, alasan itu saya mati. Jadi apa yang harus dilakukan?
What should I do? Because although I'm a nurse, I have a background, I have this experience. Because he is my friend, what should I do to tell him that it's not to more
Hold on, let me understand the background. So you have a friend who is actively using drugs. You're actively using drugs right now.
Jadi punya,
Do I understand it correctly?
punya teman yang dia kambuh terus dia aktif pakai.
Ya, jadi alasan kamu itu gara-gara itu.
The reason for getting relapse is because of
I understand, but I'm not asking about the reason. I'm asking about the fact. What's the fact? What's the situation?
Jadi
Is he using drugs right now?
Marek tanya nih, bukan alasannya, tapi dia masih aktif nggak pakai?
Tahun 2007 aktif. 2007 sekarang
When
saya
I met him in 2007, he was actively using drugs.
And he went to the rehab. Right. And he got.
He never met him anymore.
Oh, because he what drugs did he use?
Apa sih pakainya
I
apa?
don't understand what he's asking us.
Jadi yang ditanyakan adalah ini apa ini jadinya?
Saya bingung. Makanya ketemu dia gitu,
Kalau
kasihan
ketemu
juga.
dia
liatnya.
lagi,
Kira-kira
mau ngapain gitu.
way out mati gaya.
I have chance to meet him.
I know that I understand this part. You want me to tell you how to help your friend. I don't know what's the problem. You need to describe to me what is the problem. What is your friend doing that needs help?
Ya, jadi
Is he using drugs now, today?
Marek perlu tahu dengan sangat pasti apa yang dilakukan. Apa yang dilakukan secara pasti oleh temannya Mas Ade itu saat ini. Kita tidak bisa menolong kalau kita tidak jelas apa yang saat ini dia alami.
Dia saya bilang kontak.
Oh ya, very possible past things. But past is
Oh, so you want a hypothetical advice on something that happened in the past?
Jadi ceritanya ini berumpama-umpama ketemu lagi ya.
Nah, rumahnya dekat ke Cibubur kalau saya nyamper ya.
Oh, tapi kan nggak tahu pastinya dia lagi terakhir atau enggak ya.
Terakhir masih saya buka seperti itu lagi gitu.
What if? I don't do what ifs.
Ya, Marek nggak mau bekerja dengan
No,
seumpama-seumpama ya. Ada hasil seperti itu.
Makanya apa?
Nggak boleh seumpama-seumpama, nggak boleh.
Sendiri kan nih.
I understand, and I would be happy to help and talk to you and etc. But the what if scenario doesn't work. I don't know. I mean, you're not giving me. There's too many loose ends, and I don't want to make a recommendation about something that I don't feel like I understand what's going on. So if somebody is using drugs, one advice that I can give you: do not take friends into treatment. Alright, if somebody is your friend, or somebody is your relative, or somebody has a close relationship with you, you should not be helping them.
Jadi Marek tidak ingin berbicara dengan pengandaian-pengandaian ibu bapak-bapak ya, karena itu agak sulit buat dia. Marek tahu bahwa kita ingin tahu bagaimana seumpamanya ya. tapi kita tidak bekerja dengan seumpamanya. Harus lebih jelas apa yang dilakukan. Dan kalau kita punya teman seorang pecandu, jangan coba-coba untuk menolong dia dengan membawa mereka ke tempat terapi.
You should get him information. You should tell him, look, these are your options. In Jakarta, there are these programs. There are programs that deal, or doctors that can help you with sexual performances. And they are located this, and this. You help him find information. These are the clinics. If you have a drug problem, these are the problems, these are the experts. There's people in Jakarta who deal with drugs are this, and this. And you encourage them to seek help. And you help them. You take them. Let me drive you to the treatment center. You want me to make a call and find out more? I will. But you should not be his treatment provider because you have a friendship, you have other relationships. It's going to complicate things.
Ya, jadi kalau kita teman, ya, jangan kita berikan terapi kepada dia. Berikan saja informasi di mana bisa ditemui tempat-tempat terapi di Jakarta. Kalau kita ingin mengantarkan dia, silakan antarkan. Tetapi bukan kita yang memberi terapi lagi, karena ada hubungan yang berbeda ya. Kita emosional berbeda.
Alright. Any other questions?
Ada lagi pertanyaan lain?
Yeah, go ahead.
So for every session of BDRC, we need to set up a goal for every session. I mean, we decide ourselves.
Yeah.
I mean, what topic we want to talk about.
Yes.
So no kind of a manual for session 1, talking about
There is a
session
manual.
2. Like that?
You see, I made a decision for the first contract. I told you, I'm telling you,
Yeah.
the first contract, the first behavioral change is coming to treatment. Always. There's no exceptions, no ifs, no buts. This is what it is, the first time around. Then, what's the second goal? What the second goal depends on the patient. If you may already have, there's some patients who, as soon as they start methadone, they're not using street heroin. Okay? So you do not work with them on abstinence. You work with them on relapse prevention. Right?
Ya, jadi Ibu Vivi jadi gampang nih. Jadi setiap kita ada sesi pasti harus ada tujuan akhir ya. Nah itu tujuan akhirnya apa? Ada nggak manual yang bisa ditulis tuh, tujuan kedua ini, tujuan ketiga ini dan sebagainya. Marek bilang yang diberikan hanya tujuan yang pertama saja, sesi pertama, yaitu yang bersangkutan harus datang kembali. Ya. Yang kedua, ketiga, keempat dan sebagainya sangat tergantung dari pasiennya, kan kita perbedaan individual ya. Bisa jadi umpamanya yang kedua, yang ketiga adalah tujuannya adalah untuk dia mencegah kambuh. Ya, tentu berbeda dengan orang yang memang dia harus berhenti pakai. Ya, jadi bukan itu yang disasarkan, tapi mencegah kambuhnya. Jadi memang tidak bisa sama.
Yeah. Some of your patients will have difficulty getting to the 1 day of abstinence, and you will be working with them on the 1 day of abstinence.
Ya, ini contoh lagi yang lain. Mungkin saja nanti ada pasien Bapak Ibu sekalian yang dia masih tetap pakai, ya, selain metadon mamanya. Ya kita bisa bilang akhirnya, tujuan akhirnya dia berhenti pakai selama 1 hari saja. Kan nggak bisa disamain antara satu sama lain.
Some other patients will have hard time to get into 1 day abstinence. You will be working with them on cutting from 10 bags of heroin per day to 5 bags per day to 2 bags per day to 1 to 0 or something like that.
Ada lagi pasien kita yang lain, yang memang nggak bisa, jangankan berhenti sehari gitu ya, setengah hari jadi nggak bisa, jadi harus tetap pakai juga. Nah mungkin kita akan mengurangi tujuannya, sesi tujuan itu adalah mengurangi dari yang tadinya biasanya 4 paket menjadi 3 paket, 3 paket, 2 paket, 2 paket, 1 sampai baru 0 ya. Ya, one more question.
No, I didn't finish it. I'm trying to find the best. Never mind. So some patients, after you deal with the drug use problems, some of them will be already working. So there's no intervention for you. For some other patients, your goal, behavioral goal, will be to find employment, part-time employment, becoming self-supported, self-sufficient, independent. Some patients will not have friends. They will need repairing family relationship. So the actual course of treatment after the first session, it varies. The goals, behavioral goals, may vary a little bit from one patient to another in sequence. The sequence of goals will vary.
Ya, jadi tujuan perilaku dari masing pasien kita tuh berbeda-beda. Pasien lain mungkin ada persoalan dengan bagaimana dia membina hubungan pertemanan dengan temannya. Ya, mungkin itu yang menjadi akhir daripada tujuan dari sesi yang berikutnya. Ya.
I'm going to hold on 1 second. Let me just finish. But the number of goals, there's only 6 goals, all of them, right? And they're all the same for every single patient. You want them to not use drugs. You want them not to be at risk. Eliminate needle sharing, injection practices, and etc. No risk behaviors, no drugs.
Ya, jadi apapun jenis pasien kita, apapun kebutuhan dia, hanya ada 6 tujuan utama. Yang pertama yaitu mengurangi dari penggunaan narkoba ya, dan beberapa perilaku berisiko terkait narkoba.
You want to teach them new skills, like something like I did. New skills, new decision making, new information, education in this area of opiate dependence, treatment, lifestyle changes. These are the 3 areas of education. Treatment, opiate dependence, and how to make changes in life in order to sustain recovery.
Jadi ada 3 hal yang disasar dalam hal ini adalah mengajarkan klien kita untuk persoalan terapi itu sendiri. Kemudian yang kedua, what is the second? Treatment. Ya, ketergantungan klien sendiri dan bagaimana perubahan perilaku yang bisa dilakukan.
Okay. Then they need employment, they need friends, and they need things to do for fun instead of drugs.
Nah, kemudian dia akan membutuhkan teman, membutuhkan pekerjaan, membutuhkan aktivitas lain yang bisa dia lakukan untuk mendatangkan kesenangan selain menggunakan narkoba.
And that's all.
Ya, hanya itu.
Nothing else. Very simple.
Nggak ada yang lain tujuan utamanya dari terapi ini.
So we can also talk about employment and family.
Yeah.
Talking about drugs in our counseling.
Can we talk? Can we discuss about the employment?
No, you should do more than discuss. You devise contracts about employment. So, how do you find employment? Very quickly, because we're running out of time. A contract about finding a job is tomorrow afternoon, after you come back home from whatever you're doing. On your way home, you're going to buy a newspaper. On the back of the newspaper, there are a list of jobs. You're going to take this newspaper, you're going to review jobs that are potentially interesting to you or potentially have skills, match your skills. And then you select 5 of them and you bring it next to the next session and we discuss it.
Yeah.
This is a contract. This is an actual thing that you can do toward employment.
Ya, jadi kita bisa jadi yang dimaksud Marek adalah ketika kita masuk pada area pekerjaan, bukan hanya mendiskusikan atau membicarakan, tapi membuat kontrak. Sekali lagi kontrak, dimulai dengan pertanyaan kapan akan dimulai. Jadi kita akan bilang bahwa nanti pulang dari sini, nanti loh ya, hari ini pulang dari sini atau besok pulang dari sini, kamu beli koran, kemudian lihat iklan lowongan pekerjaan, ambil 5 yang kira-kira sesuai dengan ini kamu, bawa lagi ke sini pada sesi berikutnya. Jadi
quick example of handling family. So, after you educate them about opiate dependence, after you successfully educate them about the disease of opiate dependence, after you successfully educate them that methadone is not a substitution, it's not another drug, it's a medication, they're going to ask you, can I bring my wife and can you teach this to my wife? Can you tell this to my wife? And you say, that would be great, but I have a better idea. How about we practice how you can do this with your wife yourself? And then you develop a contract. Tomorrow afternoon, when you go home, and after kids go to sleep, you're going to take your wife for a tea, out to a restaurant, or to a garden, or somewhere, and you're going to talk to her about your progress in treatment. And this is how you're going to introduce the concept of disease. This is what you're going to tell her. Let's practice what you're going to tell her. You see, that's rather than picking up the phone and talking to the client, you're going to develop a contract around what he can do to educate, to repair the family relationship himself.
Ya, jadi sekali lagi bahwa kita bicara sebelum masuk kepada isu-isu yang lain adalah yang pertama adalah atapnya dulu. Jadi tadi kalau dia sudah paham betul mengenai apa itu ketergantungan opiat, kalau dia sudah paham betul apa itu metadon, baru kemudian kita masuk pada isu-isu lain termasuk masalah contohnya hubungan dia dengan istrinya. Seringkali pasien mengatakan pada kita, bisa nggak? Saya udah banyak lagi kemajuan, tolong deh biar istri saya bawa ke sini ya, biar nanti dokter menerangkan pada istri saya. Kita membuat kontrak kepada dia. Bagaimana kalau seperti ini? Nanti kapan kamu mau mulainya? Mamanya besok, silakan besok bawa istri kamu minum teh ke suatu tempat, ya, suatu tempat. Kemudian coba utarakan apa yang kamu akan utarakan. Dibuat secara detail. Nah, kemudian nanti kita bicarakan lagi sini. Jadi biarkan dia melakukan oleh dirinya sendiri. Jangan kita ambil alih kemudian kita persilakan teman.
Okay, no more examples today. I'm sorry, we're running out of time and I don't want to keep you. I know you have other responsibilities and you deserve a break from me.
Ya, Bapak Ibu kan memang pantas untuk istirahat dari Marek ya, karena punya tanggung jawab lain.
So we have one more day tomorrow. Again, read, if you can, read more, ask questions. These are very good questions that I really like the reason that you ask. Please do challenge, do bring out the questions. Do ask me questions. You're doing great. The questions are very good, very important. I want to hear.
Marek terkesan sekali ya dengan kita semua karena pertanyaannya juga kritis, pengamatan kita juga luar biasa. Jangan lupa baca, besok datang lagi dengan pertanyaan dan kritisisme yang sama seperti hari ini.
Selamat pagi.
So today is our last half day of training. We're finished early.
Ya, ini hari adalah hari terakhir kita dan kita harus selesai hari. Jadi kita akan baca di depan. Maksudnya kelas ini adalah kita digabung.
Okay. So before we go on with today's training, let's do a quick review, very brief review of what you have learned so far. So yeah.
Kita akan melakukan review ya secara singkat saja apa yang sudah Bapak Ibu pelajari sejauh ini.
So I want you to look back at the 4 interactions with the patient. We had 4 patients coming in the past few days, and I want you to look back and tell me few common things that you saw, that you remember. What caught your eye? There were certain things that were the same across all 4 of them. Do you see any commonalities in those 4 interactions that we did?
Ada 4 orang pasien kemarinnya dari hari Selasa sampai Rabu itu. Apa hal-hal yang 4-4-nya punya yang jelas ada pada keempat-empatnya?
Tell me what do you see? You see something?
Depending on opiate.
Huh?
Depending on opiate. Opiate depending.
I'm not asking actually about the patient. So let me clarify the question. So 4 days is not enough for me to show you the whole process of counseling. There's no way I can show you everything step by step in all details.
Ya, 4 hari nggak cukup untuk bisa menjelaskan kepada Bapak Ibu mengenai proses konseling itu langkah demi langkah.
So I want don't look at the patient, look at me, and tell me what was common in my behavior or your behavior, counselor behavior, from the counseling perspective. We did several illustrations, and there were things that I can find, and I'll tell you what I see and what I intended. But I want to hear from you first. Is there anything you saw that is similar across all 4 interactions?
Jadi kemarin ada 4 kali interaksi ya dengan pasien. Jadi bukan pasiennya yang kita nilai, tapi apa kira-kira yang umum terjadi pada konselornya justru.
Yeah.
I noticed that you elevated the patient to the expert level.
Yes, sometimes, not all 4 times, but yes, yeah.
Marek mengangkat pasien menjadi seorang ahli.
Questioning different counseling like used to. Active listening.
Active.
Question.
Question, yes. Very good. Yes.
Use of
Yes, so she said, let me paraphrase. So I think what she's saying that she saw that I was in charge, I was active, I wasn't just sitting and listening to the patient. I was sort of, very active, right? Yes. I was very directive. I was asking questions. I was going where I wanted to go. If I wanted to get some information, I was going for it, right? Very good. Yes, this is one of the things I'm looking for.
Ya, menurut Marek itu benar pengawasannya Ibu Kiki bahwa memang Marek aktif, jadi sangat direktif ya, sangat mengarahkan. Mau tanya apa yang dia ingin tahu itu dia betul-betul dia tanyakan kepada keempat-empatnya. Ada lagi yang lain? Ya.
Right. Yes, I did every time. I was focusing on positive, and if I found anything positive in the behavior, I instantly gave them feedback. I only said you're doing good. I never said, don't do this because it's bad for you. Very good, yes. So I was trying to show you that you can talk to the patient with very clear focus on positive. And you can always find something positive. I was saying thank you. I was saying, this is very helpful, all those things, yes.
Ya, Marek memberikan perhatian yang lebih banyak kepada hal-hal yang positif dari pasien dan memberikan apresiasi ya, penghargaan kepada pasien ya. Itu keempat-empatnya Marek lakukan.
What else did you see?
Step by step problem solution. Step by step in langkah demi langkah apa?
Prepare. You said prepare? Yes. Yes, exactly. Very important. Yes. You're very observant. Very good. Yes, prepare. This is one of the points that you see, one of the important parts of this demonstration of the 4 things, we never did something that sometimes seems natural. We had a patient, okay, let's invite the patient and let's see how it develops, right? Never. We never done. We always had a plan. We always were prepared. We had a plan. And I was, at least, you had some initial hesitations too. We always had a plan. You always had step-by-step things. And it's a little bit new to you. So you didn't know how to handle. But for me, when I wanted to go with the plan, I always went with the plan. 1, 2, 3, 4, 5. And it was easy for me, right? Because I was prepared.
Jadi pengamatan yang lain adalah terhadap empat pasien, konselor selalu mempersiapkan diri ya dengan langkah demi langkah pertanyaan yang akan ditanyakan. Tidak pernah dibiarkan dalam simulasi yang kemarin itu konselor datang maju ke tengah ruangan ini tanpa ada persiapan sama sekali. Tidak pernah ada, selalu dipersiapkan.
Well prepared to every single counseling session.
Inilah yang disebut sebagai perangkat untuk membuat kerja Bapak Ibu menjadi lebih mudah di dalam menghadapi pasien.
By the patient, and depending on what they say, you're going to come up with a solution right there on the spot. Because then you may run into troubles. It may be very difficult for you what to do. You will be forced to give an immediate advice or immediate answers. And sometimes you may not know exactly what to do. And it's going to be tough, difficult.
Ya, jadi konseling itu bukan improvisasi. Konseling itu harus dipersiapkan lebih dahulu. Karena kalau tidak dipersiapkan, kadang-kadang kita terpaksa harus melakukan sesuatu penyelesaian masalah yang kita tidak siap dan kita membaginya jadi mati gaya.
If you prepared and you follow your plan step by step, you execute. But at the same time, listen to the patient. You sort of, you give yourself time to prepare, and you can address their concerns next time. After you heard what you need to do, the questions, you have time before the next session, for example, again, to prepare yourself, and then you raise the issue. Last time, when we were talking, you raised this problem. I think we need to address it, and now is the time, and I'm going to address it. One thing, I'm going to tell you what I'm looking for. Another thing that you may have noticed, that every of those interactions went through the same sequence of events. It was like a ritual. I was trying to show you this, it's always 1, 2, 3, and 4. Every single session starts with 1, 2, 3, and 4. It becomes a ritual to some extent. It's not a ritual, but what I'm trying to say, the counseling is very highly structured. It has a very clear structure, and the patients learn it very quickly. After 2 or so sessions, they know what's going to happen. It lowers the anxiety. There's no more surprises. They kind of enjoy it. They go, okay, like you guys, now when I say, what's number 1? You say, yeah, I know, introductions. And the patient go the same way. It's getting easier and easier and easier, and they kind of play along. So keeping the same structure is actually very helpful.
Ya, jadi Marek selama 4 hari, ya kemarin 3 hari ini sudah menunjukkan bahwa yang namanya konseling itu adalah sangat terstruktur. Ada urutannya, urutan 1, 2, 3 yang akhirnya nanti kalau kita sudah biasa itu sudah terekam dengan sendirinya seperti seolah-olah seperti ritual, dan itu juga akan menjadi hal-hal yang juga terekam pada diri pasien. Jadi pasien juga udah tahu apa yang akan ditanyakan, yang akan dilakukan oleh konselor dari waktu ke waktu, dan itu menurunkan angka kecemasannya.
And the counseling is directive. It's not, again, the important point is not that sometimes people think when they start working that in order to be empathetic, you just need to listen. You sit and listen whatever patient brings to you, and this is a good counseling. And if you are too active, you are not empathetic. You're not kind of sympathizing with the problem. It's not true, not necessarily true.
Ya, ini mungkin berlawanan dengan pandangan kita selama ini yang mengatakan bahwa empati adalah lebih banyak menjadi seorang pendengar yang aktif, ya. Tidak demikian, pendengar yang lebih pasif itu tidak demikian, karena seharusnya kita lebih mengarahkan. Dalam konseling itu kita lebih mengarahkan. Kalau hanya duduk diam mendengarkan saja dengan secara aktif juga, itu berarti tidak produktif, ya, tidak menghasilkan sesuatu hal yang lebih produktif.
I hope that you saw that in these interactions that I like doing this, right? I like being with the patient.
Bapak Ibu sekalian melihat bahwa Marek tuh kemarin tuh senang melakukan itu. Kelihatan nggak kemarin Marek senang melakukan?
I'm very respectful. I actually, like you said, I actually give them a lot of credit for things. I try to treat them with respect and sympathize them and etc. But I'm not doing this by kind of commiserating with them. Oh yeah, how life is bad. I'm still trying to get them to do something that they can help themselves. I'm trying to understand, get to the core of the problem very quickly, and then help them repair certain important aspects of their life.
Ya, jadi Marek tuh senang ya melakukan hari ini, mudah-mudahan kelihatan bahwa dia tuh mencoba untuk menghargai, ya, memberikan kredit, pujian, ya, nggak tepat juga ya, pujian, pengakuan atas hal-hal yang memang positif dari diri pasien, dan dalam waktu yang singkat pun, walaupun waktunya singkat, tetap ada hal-hal yang bisa dipelajari oleh pasien itu sendiri selepas dari ruangan ini, walaupun kemarin namanya bukan betul-betul konseling, ya.
Right, and you should be in charge. You should be in charge, like I said. The best counseling session is when there's a 50-50 activity. So half of the time you are in charge, and half of the time patient is in charge of saying, of planning. It's an equal involvement to some extent, but again, you are the guy. You know, he does it, she does it. It's not that you're following the patient ideas. You have very clear ideas, and you're going to show them how and demonstrate. You have a plan.
Sebagai konselor, sekali lagi kita adalah guide yang menuntun dia. Kita yang punya gambaran yang lebih jelas tentang apa yang harus dilakukan. Klien kita tidak punya gambaran yang jelas, jadi kita tuntun dia. Sehingga sifatnya adalah 50%, dan itu kita ya sifatnya lebih kepada berperan aktif. Ya. Sebagai konselor kita berperan aktif.
So when we were interacting this morning, there were some questions. Can I use BDRC in this? Can I use BDRC in this? What's BDRC good for? And what is it not good for?
Ya, tadi saya pagi nanya, ya, bisa nggak sih BDRC saya terapkan untuk modalitas terapi yang lain? Makanya saya tanya tadi di rehab. Nah, apa sih yang bagus dari BDRC untuk saya terapkan di tempat lain, dan apa yang tidak?
And it's not a panacea for everything. It's not the best ever treatment invented. I hope you don't get this picture.
Ya, jadi menurut Marek ini kan bukan sebagai obat bagi seluruh penyakit, ya. Jadi belum tentu itu tepat untuk semua modalitas terapi.
And I don't want you to feel that you can deal with I don't have it here. I have it on the other slide. BDRC is limited, right? on purpose. The treatment, your role is not to make them happy, it's not to repair everything in their life. I want you to don't feel omnipotent. And many psychologists or counselors, they feel they can handle anything. Right? I'm so good, just bring in. Any problem you bring in, I can handle. No, it's not true. You cannot. You shouldn't try.
Ya, jadi Bapak Ibu mengingatkan kepada kita semua bahwa kita jangan merasa nanti menjadi serba bisa. Sebagai seorang konselor itu suatu sindrom, psikolog juga sering merasakan seperti itu. Bahwa kita bisa mengatasi segala-gala masalah dan juga termasuk di dalam masalah penerapan ini nanti ya. Belum tentu itu bisa dilaksanakan dengan baik pada berbagai kesehatan yang lain.
And especially in this particular study that you're about to start, begin to engage, your role is to be a drug counselor. BDRC drug counselor, not a psychiatrist, not a psychologist, not a family therapist, not a marital counselor, not a sex counselor, and etc. No, you do not do that.
Ya, untuk khusus untuk program ini, proyek ini, sekali lagi diingatkan bahwa kita semuanya nanti akan menjadi konselor nafsa, BDRC, bukan sebagai psikiater, bukan sebagai psikolog, bukan sebagai terapi keluarga, bukan terapi seksual dan sebagainya.
So yesterday there were 2 patients who expressed range of problems, and I'm pretty sure that some of you would have been tempted to talk to this woman about her about the child who died, right?
Ya, kemarin kita ada 2 pasien ya. Ya, dan salah satunya yang perempuan itu kan mengatakan dia bayinya lahir kemudian meninggal ya. Kita tentu ada keinginan lah untuk tergoda untuk ngomong mengenai masalah itu, membahas masalah itu.
There was the clear problem right there, on the surface. Her child died fairly recently. She must experience trauma, depression, or something, absolutely. How do we handle this thing?
Ya, si Mela kemarin mungkin saja merasa trauma atau merasa depresi karena kematian bayinya yang masih tergolong baru ya. Apa yang harus kita lakukan untuk menghadapi itu?
Should we invite her, being empathetic and understanding and being good psychologist or good counselor? Should we ask her, well, this must have been a very traumatic event for you. Tell me a little bit more about it. Let's try to understand, let's try to help. Do you think this is the right way to do it?
Bapak Ibu perlu nggak kita membahas mengenai masalah itu lebih lanjut dengan dia kemarin?
Right. No. Right. Good. The right answer is, so how do we handle something like this? Obviously, trauma, depression.
Gimana kita harus mengatasi?
Potentially.
Gimana kita harus mengatasi persoalan itu yang kemarin itu mengenai kemungkinan trauma pada diri Mela karena kematian bayinya.
Kita berikan waktu juga karena
If we have to give them merasakan depresi jarang seperti itu,
tidak menjadi lama.
Don't give her.
Just let her release her tension.
In what way would you like to release the tension?
Ketika dia bercerita tentang saat saya meninggal, kesulitan di waktu itu masuk untuk perasaannya untuk bagaimana lalu dari hal itu kita ambil suatu memberikan semangat kepada dia untuk lihat ke depan.
Maybe I'm going to make a slightly different recommendation. So what you're saying that we do some sort of an intervention, that we'll try to learn a little bit more about it and try to do a kind of mild or weak intervention, as I understand, yes?
Ya, jadi Dr. Bella tadi bilang menurut Marek berarti kita akan melakukan intervensi ya, tapi singkat untuk yang singkat lah ya, yang moderate ya, untuk mengatasi persoalan kematian itu.
That's not what comes to mind. I wouldn't recommend it. I would recommend that you are not the only person who can help her. All right. So, first of all, do not explore. Do not go on an exploratory. If you discover a clear problem, don't go and try to open up and explore and don't open old wounds. It happened a few months back. She's not crying. She's not crying for attention. There's not a depression in a sense. What's going to happen if you start asking a question? She's going to cry. And again, we're not going to bet on this, but that's exactly what's going to happen.
Ya, Marek tidak merekomendasi kita untuk mengeksplorasi persoalan itu. Pertama, bahwa itu kejadian sudah berlangsung beberapa bulan yang lalu. Pada saat kemarin dia tidak menangis. Ada banyak luka nanti. Kalau kita buka, kita berikan kesempatan, akan ada banyak yang emosi yang keluar dan itu betul-betul akan menghabiskan waktu. Rencananya sebentar, malah jadinya nanti jadi lama.
And look, she is depressed, and she absolutely experienced trauma, and it's not gone. It's there. It's an important problem for her. It will be fine about it. But she is stable. There's no immediate danger of any kind. She's not suicidal. It is not a problem that you may see it as a problem, as a point of entry of your intervention. It is not. I want you to really be careful with it and stop yourself. If you see something like this, I can help. If I only understand a little bit more, I can help. Stop yourself right there. Don't go.
Ya, jadi ini Marek memperingatkan ya pada kita semua, kalau ada masa-masa seperti itu, tolong seberapapun keinginan kita untuk menolong, stop. Jangan lakukan lebih jauh lagi. Memang dia depresi pada saat itu, memang dia juga mungkin trauma. Tetapi pada saat di hadapan kita kemarin tidak ada tanda-tanda dia mau bunuh diri, tidak ada tanda-tanda krisis dan sebagainya. Jangan bergerak jauh. Ada banyak orang yang bisa menolong dia, bukan hanya kita. Ingat sekali lagi, kita hanya sebagai konselor nafsa.
So if you see an acute problem, somebody who is clearly in a clinical depression, clearly suicidal, constantly crying, cannot focus, you know what I mean. Or somebody who's bleeding, who, like I said, had a cut, needs medical attention, right? You do not delay any intervention. You said them, okay, because you're bleeding, or because you have such a high fever, you need to go and see a medical professional. Because you're in depression, because you're suffering, you need to see a psychiatrist. You handle these problems. If they are acute, you handle them by immediate referral. Do not ignore them, right? Do not ignore them, do not handle them, do not deal, do not put a different hat and help. You're not going to help. You're going to run into trouble. See, something dangerous, immediate, refer, send them out, make sure that they go. Follow this. Did you go? Are you getting help? Yes, I am. Then you move on.
Ya, jadi kecuali kalau kondisinya akut, ya, apa yang harus dilakukan Bapak Ibu sekalian? Rujuk, atasi dulu akut itu, tapi bukan oleh kita. Jadi jangan ditangani, tapi juga jangan dicuekin. Kalau kondisinya akut, darurat, ya dia berdarah-berdarah, atau kelihatan betul ada tanda-tanda bunuh diri dan sebagainya, segera rujuk saat itu juga dan ikuti dalam kita, bukan kita ikutin dia pergi keluar dari ruangan kita, tapi kamu tadi pergi nggak ke ruangan dokter ini atau ke UGD dan sebagainya. Nah, baru kemudian kita bergerak ini lagi.
If the problem is not acute, it's not immediate, it doesn't look like it has to be done anything right now. The patient has clear problem, but somehow pending. Don't do anything. Give it a time. Wait 4 sessions. All right? 4 or 5 sessions. That's how long you wait.
Kalau kondisinya nggak akut dan tidak terjadi apa-apa seperti kemarin, tenang, stabil, kemarin memang depresi tapi stabil, jangan beri perhatian, jangan dieksplorasi lebih jauh. Tunggu sampai kurang lebih 4 sampai 5 sesi. Jadi jangan langsung ditangani segera saat itu juga.
As you working with the patient on the drug recovery issues, on the risk behaviors and etc., what you're supposed to do, you're going to learn more about this problem. You're going to see whether it's going to interfere with the recovery or not. how big it is, how immediate it is, whether it requires attention. You have time to learn more without actually probing, without opening the wound. Yeah, it will become apparent what needs to be done over time.
Jangan khawatir Bapak Ibu sekalian, seiring dengan waktu nanti, semakin lama kita menghadapi dia, setelah masalah ketergantungan opiatnya dia paham betul, masalah terapi dia paham betul, kita akan punya waktu khusus untuk bisa menggali lebih lanjut mengenai persoalan yang tadi, yang awalnya ditemukan. Jangan digali saat itu juga, karena kita akan melihat setelah 4-5 sesi, apakah masalah tadi itu menjadi salah satu hal yang mengganggu proses pemulihannya. Kalau enggak, kalau iya, itu berarti menjadi agenda dari pertemuan berikutnya.
And if you read the manual, in the BDRC manual, there is a session number 6, which I described as a summary session. There's no magic in number 6. It can be number 5 and number 4, but at some point, after you make some progress, I am asking you, or the manual asks you to do a summary session, where you review the progress so far that the patient made with you, and you make recommendations, what needs to happen.
Ya, jadi dalam sesi 6 dari pertemuan dari konseling Bapak Ibu tadi adalah merupakan sesi pengambilan kesimpulan, ya. Itu digunakan untuk mereview keseluruhan dari apa yang sudah dijalani selama sesi 1 sampai sesi 1 sampai sesi 5.
Right, somewhere. You find it anyway. It's there. Trust me. When you read it. There. During this session, you will review the progress with the patient, and you tell them something following, that in the course of what you have done, you discover something that may be additional problem, that may be additional obstacle for recovery, like for this particular woman, perhaps your trauma associated with losing your child is causing you emotional disturbance that limits your ability and maybe potentially trigger in recovery. I'm recommending that you go to psychiatrist, to somebody who specializes in trauma issues, in depression issues, and the patient can be simultaneously involved in BDRC and in another training in another place, helping for other things, whether medical, whether psychiatric, whether legal, or etc. Family, sexual, marital, everything. Somewhere else.
Ya, jadi nanti dengan seiring dengan waktu dari sesi ke sesi yang lainnya, pada sesi ke-6 itu nanti menjadi suatu, bukan tapi pasti di ke-6 ya, bisa jadi ke-4, ke-5, atau ke-7, merupakan suatu sesi yang mengumpulkan, mereview kembali atas berbagai macam persoalan yang sudah diterima, yang sudah dijalani oleh yang bersangkutan, dan mungkin saja tadi dalam sesi kesimpulan tadi, kita kembali lagi pada persoalan kematian anaknya. Kalau ternyata kita lihat bahwa kematian anaknya itu menimbulkan trauma dan mengganggu kestabilan emosional dia, mungkin kita harus mengambil suatu tindakan lebih lanjut, yaitu merujuk dia kepada seorang psikiater atau ahli yang lain yang memang ahli di dalam mengatasi masalah trauma.
BDRC is not the best solution for trauma. It's not the best treatment. So remember, it's a limited treatment. It's not a treatment for everything. You will not fix everything.
Mediasi bukan segala-galanya, sangat terbatas, dan mediasi bukan cara yang terbaik untuk mengatasi trauma.
Ya, kalau pada saat kita konseling itu kan itulah masalah-masalah pasien kan, misalkan ada lebih daripada satu masalah. Sedangkan untuk pertemuan berikutnya kan kita kontrak nih, kita menyelesaikan satu masalah. Berarti yang masalah yang lain itu PR buat kita.
When we talk to the clients, there are a lot of possibilities they hear us various problems, but we only focus for one thing. Is it our homework to talk about the rest of the problems next session?
Like what's the rest of the problem? Give me some examples.
Contohnya masalah-masalahnya tuh yang banyak tadi itu apa?
Misalkan penggunaan obat lainnya, obat terus,
For example, taking sleeping pills.
Terus yang masalah apa mengikat punya anak lagi itu kan ada pada kemarin itu kan ada beberapa masalah.
Another baby.
Okay. So you gave me two examples. Taking other drugs or pills or medication? Or what do I do about, should I have the baby, another baby? Like, this is a good example because some of you recommended yesterday, you made a big boo-boo. Anyway.
I was kidding.
No, can you translate?
Ya, jadi Marek.
Yeah, consistently. Or did your pattern of use changes? Actually, if you look in English, it says, and I think this is the direct translation for item number 6, is over time. You know, it doesn't even say in the past month, it just says over time. Did you tend not to vary your pattern of use?
Over time means,
Well, you know, in the Indonesian version, the Bahasa version, over time means during the past month. Okay. In the English version, over time, you know, is not defined. It doesn't say in the past year or the past month. It says the questions apply to the time period immediately before you started the current treatment. So, in the past month is a good, that's good. I think that's not my concern. It's, did you tend not to vary your pattern of use of heroin? Not to vary. Not to vary means was it consistent? Yes or no? So, I think that's, you know, it's the pattern of use is not the amount of use. It's you know, the frequency of using heroin. Was it consistent during the month prior to? But I don't know if somebody said would just hope that we could ask it in a way that people will easily understand. So.
I get your point, so
If you,
I will,
you know, anyway,
sebelum mengikuti rumah tangga metadon, apakah pola penggunaan heroin Anda itu cenderung konsisten? Itu deh. Jadi polanya, jadi kita nggak ngomongin mengenai tidak mengikuti pola.
Versinya enggak, tapi pola tertentunya konsisten tetap terus konsisten tetap terus dia pakai itu. Mau dia pakai berapapun bukan urusan kita, terus dia pakai.
Oke.
Ini interview, by interview. Oh, ya jadi mungkin kalau yang interview ini dijelasin lagi masing-masing di sini.
so I think this is only to establish a diagnosis
Yes.
prior to treatment. So we would not repeat this at 6 and 12 months. But we do want to just be able to say everybody in the study met criteria for dependence prior to the treatment experience.
Ini cuma bulan pertama baseline.
Yeah. We move on.
7. Apakah Anda semakin mengabaikan kesenangan dan minat lainnya demi memuaskan penggunaan heroin pada waktu sebulan sebelum mengikuti rumah tangga metadon? Month before entering the methadone program, have you neglected the pleasure and other interests for pleasuring the heroin use?
Okay.
Is it the same meaning?
Yeah. In English it says, do you increasingly neglect other pleasures or interests in favor of using heroin?
Maybe we can put him, for example, your hobbies,
Yeah. If they have a hobby, that's the criteria is really, did the person neglect everything else in their life, in favor of getting more heroin? Like, did heroin become the most important behavior in their life?
Time on activities like this is productive. It's actually, this is recovery, thinking, this is what everybody does. Who do I talk to? Maybe I should talk to my family about, the heavy related, because they can advise me about financial burden and etc. Not you. Family, resources, whatever she has. So, but you can help her to go through this process in a systematic way. And at this time, when she's occupied, spending time on productive activities, she's not using drugs because she's doing something else, something that is important to her, something is of value. And doing this via contract, rather than telling you should go and do this, it's not effective. But if you engage in the contracting procedure starting tomorrow afternoon, it looks like you don't have anything else to do. It's a perfect time for you to do A, B, C, D, 1, 2, 3, 4, 5. And then next time when you come, you tell me what you did. And we'll develop next step. What we're doing next.
Ya, jadi Bapak Ibu sekalian, tadi isunya kelihatannya awalnya abstrak mengenai masa punya anak atau tidak, tapi buat itu dalam konteks, dalam format mediasi, buat itu dalam sebuah kontrak perilaku. Jangan hanya sekedar memberi saran bahwa atau memberi informasi saja bahwa di sini ada dokter kandungan murah, gratis, seharusnya tidak demikian. Tapi betul-betul kontrak perilaku 1, 2, 3 apa yang harus dilakukan, dan itu menjadi bahan untuk direview pada pertemuan yang berikutnya. Ini yang disebut sebagai suatu perubahan yang produktif untuk ke arah pemulihan yang lebih baik.
Does it make sense? Does it answer your question fully now?
Saya terima kasih.
So let's go to your question. You said, how do you evaluate progress? How do you know that the patient is actually telling you what they do, and etc. Again, going back to them being liars. They are not. But I think in this mode, you should do something. I don't know. You should go to the library tomorrow and study or read this book. And the next time they can come and they tell, and you ask them, did you go? They can lie to you. They can easily say, yeah, I went, I read the book. It will be a lie.
Ya, itu benar-benar yang gampang sekali kita lihat sebagai sebuah kebohongan gitu.
Then you'll be kind of, how do I figure out whether this person read the book or not? And then you follow a bunch of questions. So, what was in the book? I guess. So, what did you read about?
Ya, kemudian kita akan terus menginterogasi dengan yang lebih lanjut karena kita ingin meyakinkan bahwa dia bohong atau enggak kan. Kita tanya apa yang kamu baca di buku, ada apa saja di dalam buku dan sebagainya. And maybe the patient is really good. They can tell you any story. You have no way of verification whether it happened or didn't happen. Ya, dan seringkali seorang pecandu juga sangat ahli ya di dalam membuat suatu cerita, dan sampai kita juga nggak tahu ini benar apa enggak, karena kita nggak punya waktu untuk memverifikasi benar nggak itu isinya buku begitu ya.
And in this model, it's very easy to lie. It's really easy, no problems. They can do it, and you have hard time.
Ini kalau caranya kayak begini kita, ya mereka gampang sekali berbohong.
This is why yesterday when I was showing you, I showed you that there's a logic, another logic, and I said I'm going to tell you later maybe. And this is this later maybe time. This is another logic why you do it the way you do it.
Ya, kemarin Marek bilang bahwa ini akan diterangkan nanti, kemudian ya sekarang ini yang akan dicoba untuk diterangkan.
So,
ya. Ini logis ya, ini yang sangat logis.
It's very easy to lie about the end, whether things happened or didn't happen. Oh no, I did not use drugs. I didn't do. Oh yes, I went to library. Yeah, I did talk to my mother or whatever.
Kalau Bapak Ibu konsentrasinya pada tujuan akhir, umpamanya tujuan akhir membaca buku aja ya, hanya konsentrasi pada tujuan akhir, mereka sangat gampang berbohong.
But if they have to tell you a detailed story, right, then yes, no, it's much more difficult to lie. Alright?
Kalau Bapak Ibu kerjanya dari awal secara detail, step langkah demi langkah, sangat sulit bagi dia untuk berbohong dibandingkan kalau kita tanya pada tujuan akhirnya tadi saja.
So, lie that concerns one single event is easy. a lie that has to be a built story. They basically, in order to lie, they need to come up with a story, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And they need to spend a couple hours thinking and memorizing in order to come up with a good story. It takes effort.
Kalau kita tanya apakah kamu baca buku atau enggak, ya dia akan mungkin berbohong karena dia hanya butuh satu cerita saja untuk bisa menghiburi kita. Tapi kalau kita tanya secara detail dan detailnya itu sampai 10 langkah, bagaimana dia bisa mengarang cerita? Karena menjadi lebih sulit, dia tidak punya kesempatan banyak untuk dia bohong.
So, I'm not saying that it will never happen, but the likelihood that somebody is actually engaged in this elaborate effort, requiring effort scheme that, okay, I'm gonna, rather than doing, I'm going to come up, spend time and come up with a fake story so I have something to tell next time. Trust me, it's much easier to just do it.
Ya, jadi itulah sebabnya mengapa kontrak ini dibuat ya secara lebih detail supaya tidak memberi kesempatan dia secara lebih luas untuk mengarang cerita.
Also for you to get a sense whether this is a true story or not, it's easy because if things has to make sense, they have to be connected. But as the patient is telling you the story, it will be much easier for you to tell whether he really is making progress or just making stories.
Ya, jadi Bapak Ibu ini bukan berarti menjamin bahwa kalau adanya kontrak ini terus berarti mereka tidak pernah berbohong sama sekali. Mungkin saja tetap berbohong, tapi karena sangat detail, langkah demi langkah, kan dia harus membuat suatu rangkaian cerita ngarang yang berkesinambungan. Jadi kalau nggak nyambung satu saja udah kelihatan bahwa ini orang ngibul, jadi nggak perlu dicek kemana-mana, nggak perlu ngikutin dia ke rumahnya dan sebagainya.
Okay, and this going this direction also helps not to discover whether it's lying or not.
Ya, jadi karena kita ngecekin satu persatu dan itu banyak, itu bisa menjadi alat untuk mengecek apakah dia bohong atau tidak.
Right.
Maaf ya Bu, seperti kayak pasien dokter Marek,
The husband used the infidelity of his wife as a reason to use drugs.
karena kan kita tahu fungsi otaknya kan besar, jadi kita mesti ngobatin kan fungsi otaknya. Jadi tindakan kita tuh seperti apa gitu dengan tugas kita sebagai pembimbing atau konselor.
We should do what we did here. We did this already. I'm going to repeat it, but
Ya, kita harus melakukan seperti apa yang kita pelajari selama ini.
Itu
So,
yang mendengarkan
let me-
Tuhan dan membantu dia bagaimana.
Loh, kan kita ada kontraknya.
hold on, not contract, not education.
She said that should we only listen to them and help them? She asked.
Listen to them and help them. No, you need to listen to them and make your own diagnosis, and then build the treatment accordingly.
Mbak, harus mendengarkan, tetapi membuat suatu apa tadi? Diagnosa sendiri dan membuat rencana terapi sendiri.
So let me finish the story with the patient, the husband and wife. So what I did the first session, I separated them and I gave him a story why I wouldn't treat them together, right?
Jadi apa yang dilakukan ini dengan terhadap pasien suami istri adalah memisahkan mereka dan menghadapi khusus hanya suaminya saja.
And then the patient, the guy, the husband became my patient. The wife did not become my patient.
Yang laki jadi pasiennya Marek.
And this person, the guy who was using drugs, went through the whole BDRC treatment. And I started by educating him that the reason for his using drugs is not his wife's fidelity, but opiate dependence, what's going on in his brain.
Jadi pada sesi-sesi yang pertama itu adalah mengedukasi si laki-laki itu tadi bahwa alasan kamu untuk pakai narkoba lagi itu bukan karena istri kamu yang nggak setia, tetapi karena ada sesuatu di otaknya.
Berarti yang mesti kita ini kan membuat diagnosanya gitu ya. Berbeda lagi dengan itunya, dengan perilakunya gitu.
So the diagnosis that we have made is about
jadi kita membuat diagnosanya gitu. Jadi kita
So
udah
first we have to
fokus ke perilakunya gitu. Karena dia
and not concentrate to the behavior. Ya gitu kan?
I don't understand the question.
Jadi gini, maksud Arta kan tadi kan Dr. Marek bilang dengan keluhan obat itu kita harus memisahkan, berarti dia masalahnya dengan pembuatan diagnosa yang baru gitu.
According to your story, then we have to separate both of them, and we only face the man and make a diagnosis first about him.
But okay, let me say something because I don't understand the question. I don't think we will understand the question. The diagnosis, there are a number. The first initial diagnosis is very simple, and you don't have to make the initial diagnosis of opiate dependence because this is the study criteria. You only going to see. It's not like people will be coming to your office in this particular study, in the protocol, in the research protocol. You will not be seeing people who have alcohol problems and not use heroin. You will not be seeing people who have marital problems and not use heroin. You will not be seeing people who have depression and not use drugs. The only person who will walk into your office will be already determined to be opiate dependent.
Ya, jadi sebenarnya Ibu Harta nggak perlu membuat diagnosa lagi, kan jelas bahwa dia adalah seorang pecandu heroin. Karena di dalam proyek ini nanti tidak ada lagi orang yang dengan pecandu alkohol atau kecanduan ganja dan sebagainya akan masuk ke sini. Dia hanya kepada pecandu heroin saja. Jadi diagnosa pertama tidak usah dibuat, yaitu diagnosanya adalah dia kecanduan heroin.
So your choice will never be like this, that you will never be in a situation where you start talking to your patient and at the first session you determine them to be not opiate dependent and you tell them, go away, go to somebody else, I'm not treating you. This should not and will not happen in this study because people will be pre-screened, they will be eligible for methadone, and this is one of the key requirements. This is a drug dependence clinic and only people who are drug dependent will be coming. If you're specialist from diabetes and you're treating, you won't be making diagnosis distinction. Does this patient have diabetes or not? So you will not be making this type of diagnosis. They all come already with diagnosis of opiate dependence.
Jadi sesi pertama kita dalam mediasi itu tidak lagi membuat suatu diagnosa apakah dia seorang pecandu heroin atau bukan. Karena nanti sudah ada screening awal kan. Semua orang yang bisa masuk metadon kan semuanya adalah harus didiagnosa sebagai pecandu heroin. Ya, pecandu opiat, tidak lagi hal yang lain. Jadi nggak perlu lagi dilakukan upaya untuk bisa menentukan apakah dia seorang pecandu atau tidak.